So this is part two of our day out here on Monday down at the hub in Douglas, Chester Street. With me on my phone is the questions that people have been on last week, and obviously we didn't get a chance to it. As always, some will be repeats, some will be just that sort of thing because people want to know the latest version of an answer.
It's always good to get the information out, Paul, no matter how many times it's said.
Don't say, as I said before, that's all I've warned. Right, what proportion of the population will need to be vaccinated to get completely back to normal? Brackets, borders. I mean, that is a big question.
Yeah, so it's not about percentages. It's about ensuring the protection of the NHS. That's what this has all been about. So it's about ensuring that hospital numbers will go low. We've got to accept we are never going to eradicate COVID, potentially. This is a virus, and it's likely to be around. Spanish flu was around long after their pandemic was over last century. So so our border policy will depend upon infection rates on the UK, having those who are the most vulnerable vaccinated and those most likely to suffer serious illness or hospital admissions. After that, we'll be able to review where we are with the borders, and we'll be able to open things in a staged approach. The border framework's on the website, and if people want to go on and see what the stages are, it's there for everyone to view.
Probably the most asked question, isn't it? And obviously people think about holidays. They maybe shouldn't, like in the UK yet, just do anything, stay as they are at the minute?
Yeah, I think at the moment, again, it's not unusual for me to urge caution, is it, Paul? I'll urge caution, and I say, I know it's frustrating for people. This has now gone on nearly 12 months. For some parts of the world, it's now been over 12 months that this has gone on, and people do want to get back to normality, being able to travel off Ireland freely. Our strategy has always been to protect the island, protect the NHS. We are at the moment in an elimination strategy for the virus, but over time, obviously things will have to move forward, and we will have to move back to normal, but that will be dependent on infection rates elsewhere and the rollout of our own vaccination programme to be able to protect those most vulnerable to serious illness from this virus.
So you have to move from eradication, don't you, to living with this thing at some point, basically?
Yeah, and there has to be a pathway to do that. There's been a lot of work going on to this, and I hope that very soon government will be able to publish what has been termed around the world as an exit strategy, so people can see the thinking in that space and where we are potentially going as an island.
This person says she has various symptoms and she suffers greatly from complete exhaustion, chronic body aches. The meds doctor and her GP have said she expects the symptoms to persist for 3 to 7 days. I should add, this is after having the jab. It had all these sort of things happening. She's 41, physically fit. What happens to those people like that? What risk is there, and should they go for the second jab, I think, just to summarise that one?
Yes, they most certainly should. It's the second jab that actually builds in the efficacy, so it's very important people do have the second jab. Different people react in different ways to vaccinations. It's not unknown, and I think we have emphasised before that there will be people who will have sore arms, they will have flu-like symptoms that may last for a few days. That actually shows the vaccination is working, the body is having a reaction to the vaccination. It's nothing for people to be concerned about. That is normal after you have a vaccination. That's exactly the same when some people have the flu vaccine as well.
And people are still sitting here for 15 minutes regardless of which one they're getting, are they? Or is it just the one?
It's just the Pfizer. It's only the Pfizer that has the recommendation.
How's it going? Do you mix and match today? Is it some people get one, some get the other? Was it one day is this, one day another?
No. Here it is purely at the moment the Pfizer. This is the replacement for Newlands, and the people coming through the hub today are receiving the Pfizer vaccine.
You've got the fridges?
We have the fridges to keep it at the temperature required, and also obviously the packs can't, as we've said before, be split, so we have to do the 975.
Interesting, they're working on Formula 2, I noticed. That one may not have to have that, which would be obviously helpful, wouldn't it?
It would be hugely helpful. Obviously, each vaccine has a different logistical challenge. The AstraZeneca vaccine equally has logistical challenges as well that are slightly different to the Pfizer vaccine. But I've got to say that science is moving on all the time, and hopefully we will have much more mobile vaccines available in the future.
If a patient's relatives come over for an end-of-life visit, is it true that they can go straight to hospital to visit without isolating and without having a COVID test?
No, it's not true. They have to have their first COVID test to show that they are clear, after which they can go to the hospital, but they have to use appropriate PPE. If it's a very close to end-of-life visit, they may have one of the rapid tests up at the hospital itself, where they're isolated away until such time as the result comes back, but they still do have to employ social distancing and PPE.
Can we find out whether or not uni students that normally have accommodation paid for by the government grants are still getting that money? Those who live on campus are no longer paying their fees to the uni, so just wondering whether they can still get the money or whether it can be used elsewhere.
My understanding is the grants are being paid as normal.
Okay, simple as that. And if not, there should be a problem. Well, they should contact who?
Well, the Department of Education,
Right.
but my understanding is the grant system hasn't changed. Nothing's come across my desk, but then I'm not the Minister for Education. But certainly I've not seen anything to suggest that university students haven't been having the grants that they're entitled to paid as they are normally.
This person says they believe that it's important to the island to ask the Health Minister about if it proves the rollout policy of AstraZeneca is wrong and we are 30% less effective than the UK. Oh, this will be about the time difference, I suppose.
Right. Well, we need to be very clear on this because this is relating to a preprint report that was put in the Lancet. Now, we need to be very careful about saying that it's 30% less. That's been taken up by some of the media who I'm not 100% certain of reading the report correctly, because what the report actually looks at is it actually looks at what happens if you extend the time between doses. It doesn't actually say delivering the doses 21 to 28 days apart doesn't provide efficacy. In fact, the report doesn't even look at that. It actually looks deliberately at what the UK was doing as to what happens after 12 weeks. So, in fact, the first dose is showing as being 76% efficiency alone, and then it rises to 82.4.
Yes.
So even on that report, the actual net gain overall is 6%. So we need to be a bit careful of banding about the 30%, because what you're doing is you're comparing two different things, because the 30% difference, which is the 56, came from the initial trial reports. Now the actual real life use of AstraZeneca, particularly in countries that are currently using it, is showing a lot more than that. So people are comparing apples and pears, and I think that's where some of the media have got confused, particularly the UK newspapers. They've taken the trial data, which was under different circumstances, and trying to apply it to this preprint report, and you can't do that in science.
It's an interesting, risky thing, isn't it? Because it could have gone either way as well. I mean, it could have been proved the UK had gone wrong, and you were on the right path.
It could.
But, yeah. Okay.
I mean,
so both are okay.
The point is both work.